Hi, hello, and welcome to Dr. Ashwinth Dental Info. Today we will be seeing a very important topic, and in fact, this topic will have the most number of doubts in a student's mind, which is the acid-base disorders. No matter how many times you read, you still have a doubt of what is respiratory acidosis and respiratory alkalosis, and this video will be an eye-opener for sure. So, first of all, let's start with the basics. Acidosis is decreased pH and alkalosis is increased pH. This we have been learning from our school times. So we divide this as respiratory type and metabolic type. Respiratory has acidosis and alkalosis, metabolic also has acidosis and alkalosis. First of all, we will see this formula, which is CO2 plus H2O gives H2CO3. This is a reversible reaction. So where does this equation come from? CO2 in the lungs mixes up with water in the blood to form carbonic acid. So till here it's clear. So carbonic acid again disintegrates to form HCO3, which is bicarbonate plus H plus ion. If you know this equation, the whole of acidosis and alkalosis can be easily sorted out. So let's start. When you have more carbon dioxide mixes with blood, more formation of carbonic acid, more formation of bicarbonates, more formation of H plus. But remember this, when CO2 is increased, you link these extremes. When CO2 is increased, H plus is also increased. Okay, so when CO2 is increased, H plus is also increased, which means pH is lowered, right? So when H plus is increased, pH is lowered because H plus is acidosis. In acidosis, pH is lowered. Then the reverse is also true. When you have decreased carbon dioxide, you have decreased formation of carbonic acid, and so there is decreased formation of H plus. So decreased H plus, which is increase in pH. So all these reactions are dependent on the level of carbon dioxide in the lungs. So these two are examples of respiratory acidosis and respiratory alkalosis. To be simple, let us not go into the depths of it. So next comes metabolic acidosis and alkalosis. We will focus on this part here. This is the bicarbonate and the H plus ion. So any disturbance on the right side of the equation will cause metabolic effects. Okay, this is the simple rule to remember. So whenever H plus is increased here, or the other case can be when bicarbonate is lost. When H plus is increased and bicarbonate is lost or decreased, it leads to H plus increases, decrease in pH. It leads to metabolic acidosis. Okay, if you feel confused, you can pause the video and think for a moment. You will get the answer for sure. And then the reverse happens. When H plus is decreased and HCO3 is increased, the pH will rise and it leads to metabolic alkalosis. So you are clear with the equations and the conditions, but how do we link this with the clinical scenario? When someone is having metabolic alkalosis, what are the symptoms he has? Or how can you find a person whether he is having acidosis or alkalosis? So there are a lot of clinical parameters. But in this video, we will stick to the theoretical parameters first. We will move on from the first condition, which is respiratory acidosis. So you have an increased amount of carbon dioxide in the lungs. So where do you have increased amount of carbon dioxide? Which means that there is some problem in the lung, which is hypoventilation or COPD or pneumonia. These conditions you will have respiratory acidosis. And then where will you have respiratory alkalosis? So you know the carbon dioxide is increased here. in respiratory alkalosis, carbon dioxide must be decreased. So where will you find decreased carbon dioxide? In case if the person is hyperventilating, he will have more amount of oxygen and very less amount of carbon dioxide. So when carbon dioxide is decreased, you can follow the equation. Carbonic acid is decreased, H plus is decreased. So it leads to respiratory alkalosis. So the respiratory part is clear now. So there are a lot of examples. I am sticking on to the basic things so that we will remember what is needed necessarily. And then we are going to the metabolic part. In the metabolic part, we will have metabolic acidosis. So it means that acid is being formed more in the system. So the examples will be diabetic ketosis, where keto acids are being formed, or lactic acidosis, and it is also seen in diarrhea and renal failure. So you have metabolic acidosis is seen in diabetic ketoacidosis, lactic acidosis, renal failure, and diarrhea also. Okay, and metabolic alkalosis is seen in severe vomiting and diuretic therapy. The point to be noted here is metabolic acidosis is more dependent on the decrease of bicarbonates rather than the increase of H plus. It is always the decreased amount of bicarbonate which is responsible for the metabolic acidosis. Unlike in respiratory acidosis, we have an increase in H plus. But in metabolic acidosis, we may have an increase in H plus, but it is predominantly a decrease of bicarbonates. And also in metabolic alkalosis, there is increase of bicarbonates. So what are the conditions here? We have seen this: severe vomiting, diuretics, etc. And also, if we are taking a lot of antacids for GI problems, which can also cause the increase in pH, which is metabolic alkalosis. Now we know how important is the pH value, how important is the bicarbonate value, etc. Right? So to correlate it clinically, the normal pH should be around 7.4, but to be precise, it is 7.35 to 7.45, and the bicarbonate value is 22 to 26 millimoles per liter. So this is in brief about acidosis and alkalosis. We will have a short recap now. So we have divided it as respiratory and metabolic, and there are two types in both of the things. You have the equation carbon dioxide plus water gives carbonic acid, which later can disintegrate into bicarbonates and H plus. So increase in carbon dioxide will lead to increase in H plus because the equation shift to the right, which forms more carbonic acid, more H plus ions, and decrease in carbon dioxide will lead to decrease in H plus. The reverse happens here, which is a respiratory type. And we have seen the examples where all carbon dioxide increases and where all carbon dioxide decreases. So to be a practical example, if a person is having fear or he is anxious, he will get into a panic attack. So a panic attack is simply called as a hyperventilating event. So when he hyperventilates, what will happen? When he hyperventilates, carbon dioxide will decrease because there is increased oxygen partial pressure. So as the carbon dioxide decreases, he will have respiratory alkalosis, which is, so hyperventilation will cause respiratory alkalosis. This is the most confused thing. We will be confusing whether it is hyperventilation or hypoventilation, but it is as simple as that. So when he is hypoventilating, you increase the amount of carbon dioxide in the lungs so that the H plus will increase. So it leads to respiratory acidosis. And also there are compensating mechanisms. Whenever there is a respiratory acidosis happening, the body compensates it by doing a metabolic alkalosis. And whenever there is a respiratory alkalosis, it does a metabolic acidosis. A recent study says that both respiratory and metabolic can be altered, but there are a few shortcomings which are still to be discovered. I will post it as a short of as a shorts video of what is the problem between handling this, because this is the most important topic of clinical practice and still more things are yet to be discovered. So stay tuned with my channel, and if you find this video useful, please give me a like and a subscribe and share it with your friends. Thank you.